Hello, everyone. My name is Dr. Gili Segal, and I'm a licensed clinical psychologist and a clinical associate professor at the Department of Child and Adolescent Psychiatry at NYU Health. And today we're going to talk about the mindful family. How could neurodiverse families, that is, families with at least one member, either a child or a grown up, who's autistic or neurodiverse, practice mindfulness together? So, thank you so much for joining. And let's go ahead and start. We want you to know that this workshop is brought to you by the New York State Regional Center for Autism Spectrum Disorders at the Child Study Center at Hassenfeld Children's Hospital at NYU Langone. And we also want people to be aware that this content that's going to be presented today is informational and not a clinical advice. So here's our overview for today's talk. We're going to start with talking about what is mindfulness. I know that it's been kind of like a very common buzzword in the past few years, but really trying to clarify this a little bit more, what it is, what it isn't. We're going to talk about mindfulness and the way that it could be related to family life, parenting life, if you'd like. We're going to talk about what are the benefits of mindfulness based on research and science. We're going to get a tiny bit of a taste of how it is to practice mindfulness because it's a very practical skill and it's not just, a concept that you learn in theory. And then I'm going to give some strategies and some ideas to really put it all together and to really try, if you've been kind of like convinced that it could be helpful and beneficial for your neurodiverse family, to try to implement it in your daily life. So let's go ahead. So here's the kind of like official definition of mindfulness. Mindfulness is the awareness that arises through paying attention purposefully in the present moment and in a non-judgmental way. And this really nice fellow that you see here meditating is Dr. Kabat-Zinn, who is one of the pioneer researchers that also kind of like were able to combine Eastern and Western mental health theories and ideas and kind of like bring mindfulness and meditation to the Western medical world. And really to also show in research, in extensive research work, that actually it has a lot of very positive effects on mental health, but also on physiological measures. So let's talk a little bit more kind of like practically. So what does it mean to be mindful? That means putting more focus on your observations about whatever it is that's in your experience, either internal processes or external stimuli that, what happens around us in our environment or in our body or mind or all of the above. But the distinction of like not becoming this thing, that is many times when we have a certain thought on, or when we experience a certain body sensation, it's kind of like everything that's on our mind. And when I say observing, not becoming, I'm putting much more focus on becoming aware of the thought, of the body sensation, but really being also aware of everything else that's going on and not necessarily really soak in just this one thought, this one body sensation, and more on that in this coming demonstration. So, how do we do that? We want to anchor ourselves. So, a huge part of mindfulness practice is going to be anchoring ourselves in a particular feature of our experience, many times we're going to use our breath, our breathing process. Our breath is always there, thankfully, and at least in the good case scenario, right? And wherever we go, we can really try to anchor ourselves in our breath in order to be more mindful of what's going on. So, how does it look like? It's like aiming a flashlight and really trying to shift our focus of attention to this anchor. So again, it could be the breath, but it could be also our belly, right? Or it could be for pregnant women, their fetus movements, whatever that is that you want to focus on. It could be something external. It could be a certain sound. I want to be mindful of a certain sound. So this is going to be my anchor. But again, the breath is really, really helpful because no matter where we're at home, at school, at work, and at the subway, we always have our breath with us. So we're going to aim the flashlight of our attention and really try to focus on the breath. But then what will eventually, and actually very, very soon, going to happen is that we're going to notice all sorts of other things that are going on, that are happening other than just our breath. That is, if we have certain feelings, or maybe the temperature, right? It's too hot, it's too cold, or maybe there are some sounds and noises coming from our outside environment, that is our home, our cell phone, our neighbor's home, or whatever. And then what happens very naturally, very normally to our attention is that it drifts away, either to this or that, to one of the other stimuli. But what we can do is we can either split our attention, and that many times what happens very naturally and not necessarily in a conscious or an intentional way. But can we notice, right? And really become more aware of what's going on with this flashlight that we have, in our mind, and escort our attention back gently but firmly to our anchor. So this is the mindfulness practice, okay? So whatever comes, I'm going to keep focusing on my anchor. So if I'm practicing mindfulness of my breath, whatever sounds, whatever feelings, whatever thoughts, whatever body sensations come to mind, I will notice it, but will keep focusing on my breathing. I will not necessarily push away the other things that I'm noticing, but I really want to aim this flashlight on the one anchor. Okay, and that brings me a better sense of control of where my attention is focused on. And this is mindfulness. So I hope that at this point, after, the example, it's a little bit clearer. So it's awareness, again, that arises through paying attention on purpose in the present moment, because it's what's happening right now, right here, and in a non-judgmental way as much as possible. What mindfulness is not, okay? Very common misconceptions. Again, I told you, like, it's a very common buzzword and people have all sorts of ideas about what mindfulness is. I'm already telling you, mindfulness is not when you're focusing on your future, on your plans for tonight. What will I make for dinner, right? Or the past. How did she say that to me, right? Or how has this happened? Mindfulness is not when we're worrying, when we're being mad or upset. Mindfulness is also not about being happy or proud. And it's certainly not about expecting, right? Many times people tell me, oh, I practice mindfulness and I really expected to feel this way or that way, or I really wished for something to happen. That's actually not being mindful. Mindful is really being very focused on what there is now and not what there is in theory or in potential, or, whatever the content of our thoughts is. And most importantly, it's not about relaxation, okay? A really common byproduct of practicing mindfulness could be relaxation for many people, but not for everyone and not at all times. When practicing mindfulness, sometimes a really fun experience is like, hey, so I was focusing on my breath, but now I'm feeling calmer. It was somewhat soothing or grounding. That's great, but it's not always going to be the case. And again, we don't want to be expecting or wishing to feel better after practicing mindfulness, because if we're very tense or very stressed out about something, practicing mindfulness will probably not, make us feel good right away. We will talk about why still, it's beneficial to practice. But let's talk a little bit about mindfulness in the context of family life. So I'm sure that everyone here, if they have children, if you are caregivers of a neurodiverse individual or just, neurotypical individuals as well, try to remember like the time where you were just planning for your family, for your parenting style, right? It probably looked something like that, like really happy moments of, ultimate calmness and sweetness and just, having it all in life, right? This was our expectation. Mine too, I admit. But then these all really legitimate wishes and expectations really are strongly linked to our parenting values, right? When we, knew that we're about to become caregivers or parents, we're like, oh, I'm going to be such an involved parent. I'm going to be a calm parent. I'm going to be a caring parent. So whatever your parenting values are, it's probably very rewarding when you get, a chance to act in alignment with what's important to you as a parent. But then again, how does parenting and family life look in reality? Many, many times more like that, right? For all of us, people, even for the child psychologists among us, this is happening, okay? This happens, and that's very natural and very normal. And that is because we're all human beings and we all have our moments and we all have our feelings and our stressors. And really, life is far from being perfect, far from being ideal. And, anyone who will say anything else, I say be very skeptical about it. Okay. So, I guess the kind of like challenge for us as caregiver is like, how do we make sure to have less of these moments and more of these, right? It's more a matter of balance, I guess. Like nobody really expects to not have these moments at all. But of course, when it becomes too often, when it becomes like 24/7, these kind of moments, this could be just exhausting. And, people are burnt out and kind of like forgetting about all of these really important parenting values. So let's break it down for a second, okay? What happens in your body or your child's body when, something happens, right? So let's take an example, based on a true story. And, let's say that you have an wonderful, but also very strongly opinionated 8 years old child. And you ask her to just go and brush her hair, right? Because last week's hair situation was quite brutal. So we're like, okay, tonight we're going to do everything great. We're going to make sure to brush your hair, to put on the detangler, to make sure that tomorrow we have no hair situation at school. You're really working in line with your parenting values of being caring and being proactive and whatever that is. But then you get a very common reaction from your child who's totally now obsessed with her new rainbow loom bracelet kit. She's like, no, I don't want to do that. Or just won't respond, right? Which is sometimes even more triggering for us parents. So try to think about yourselves as parents. What's going on in your body in these moments when your child behaves in a way that really triggers you? So it could be all sorts of body sensations like pain or tension. Could be all sorts of thoughts. Why does she always push back, right? Could be emotions and action tendencies. Action tendencies, usually in stressful times, not very helpful, right? It's not that your action tendency in such a stressful moment would be to, go and hug her or something like that. If you do get this action tendency, really huge kudos from me. So, what's the idea of practicing mindfulness and how does this relate to what I was just talking about? The idea, and this is really the science behind what's going on in our experience, is that in our brain we have these two roads, okay, for addressing situations and for coping. The first one, kind of like the highway, is the prefrontal cortex. This is the part here that's, kind of like behind our forehead. And this is really the smart part of the brain where we get to plan for the long term, where we get to solve problems when we are able to communicate really efficiently with people around us. And, and also, we have this shortcut that's the amygdala, that's part of the limbic system. And that's more about survival mode. That's a more kind of like primary, a more ancient brain system that we have for survival. Okay. And this is when we get activated when we're very stressed out about something, as if there's a real danger, right? And the shortcut is very, very helpful for immediate survival mode. That is, if I want to cross the road and there's a car racing coming towards me, it's very helpful that my amygdala takes control and the shortcut just makes me run away, to the other side of the road and make sure that I stay safe. But the problem is that when my daughter is giving me the pushback that triggers me, it's not a real danger, right? It's actually a situation where I would like to use my prefrontal cortex to solve, to plan, to communicate. While what many times happens in real life is that amygdala, the shortcut, is taking control, is taking over. And then I yell, I shout, I get, very upset. And that's not very helpful for relationships, right? And also not really required. So it's not helpful, it's not efficient when there's no real danger. So the whole idea of practicing mindfulness in the family is being more present with our loved ones and being better and better able to practice this smart part of the brain, the prefrontal cortex, even when we're very much triggered. A little bit about mindfulness and ASD. Really, mindfulness could be practiced even with nonverbal individuals, and we'll talk some more about that. It's a really helpful skill to do some integration of body and mind that for many autistic people is not always super automatic, and sometimes more practice is required compared to neurotypical people in order to have this body and mind work more in collaboration and kind of like becoming more aware of the mutual effects. Autistic children, but not just, honestly, neurotypical children too, can practice mindfulness with a parent or a caregiver, but also with a teacher or with a therapist at school, at a clinic. These are things that could be generalized pretty easily. And this could also be done either by individual work, one-on-one, or as part of a group. So what do we know from research about mindfulness? Specifically about neurodiverse families, but not just. Look at all of these great benefits of practicing mindfulness regularly. So we have in literature all sorts of really nice group programs and family programs and individual trials where people were practicing as a family. And we can see that parental stress is going down, parental satisfaction from the family life is going up. They also report themselves as improved parents, as their co-parents as improved as well. And what's really nice to see is that child symptoms also, the behavioral symptoms go down. That means behavior becomes better, emotional well-being goes up, and child social communication goes up. Isn't it amazing? It's not a social skills intervention, it's a mindfulness intervention. But yes, when we're more mindful, remember that smart part of the brain, we can also communicate better. So let's just get a very brief taste of how it looks like, because mindfulness, just like any other skill, baking, swimming, riding a bike, it's not enough learning in theory. We really want to practice and practice and practice to really understand how do we get better at choosing this other way, staying at the highway, taking the highway when we don't need our survival mode to take over. So let's use our breath as an anchor. I want to invite everyone for the upcoming minute or so to sit comfortably and to close your eyes if it feels comfortable and appropriate. And let's just take a deep breath, just like you breathe, but be mindful of it, breathing in and breathing out slowly. And keep on doing that. You already breathe in and breathe out. Just pay attention to it. And when other thoughts come to mind, it's okay. You can make a mental note out of it. You can say, this is a thought about dinner. This is an itch that I'm experiencing in my left foot. Whatever that is, and go back to focusing on breathing as many times as need to. There's nothing wrong with your mind going all ways, and having all sorts of thoughts. That's the normal process. Your job is just to keep coming back to your breathing, no matter how many times it needs to be done. And let's end with another deep breathing in and breathing out. And let's tune in and just take a moment to think about, what did you notice this practice? Did you learn anything new about yourself? How was it for you? Whatever there is, it's fine. You're fine. You're just a human being, and everything that comes to mind is totally normal. Okay, a little bit about ways for you to practice on the go, because I know that some families could really commit to practicing every day for 20, 30 minutes or even more, and other families are more crunched with time. So some ideas to really do it on the go. I know that's a very common question that people have. So you can take a few minutes to do an activity of mindful singing with your child, or mindful listening to music, or mindful dancing, right? So next time when your daughter is like, let's have a dance party, Taylor Swift dance party, right? So you put on the music and you encourage them to close their eyes and to just dance and move their body. And you do that with them, right? And really try to soak in the moment, to be as present as you can, and see what comes up, right? And it could take like 5 minutes. That's all. And mindful speaking. Let's be focusing on what words are we using, what nonverbals, right? Like what intonation, what is the level of my voice volume, and also mindful listening. When was the last time that you really Stop doing whatever it is that you did, right? Put the phone aside, put the work computer aside. Really looked in your child's eyes while they were speaking to you. So let's try and do that. Let's try and do that more mindfully and take 5 minutes a day to do that. What about a mindful hug? Again, put away other distraction and just soak in the hug. Be present with your child and feel the sensation. Smell their, scent of their hair, right? Whatever it is. Mindfully playing a game. Okay, next time when your child asks you to play a game with them, just try to focus, to be present, to look at them as if you're observing them for the very first time. And of course, this picture of the coffee, a nice tip from me. This is what I do every morning when I drink my coffee. I usually do that before everyone else wakes up in the house, and just take this 5 minutes to sip my coffee mindfully, to really focus on the sensation around my mouth when drinking, feeling the, warm liquid, like, that gets into my body, smelling the aroma, really trying to be present and not like drink it on the go while cold as much as possible. Can't do it every day, but really trying to. So lastly, I'll just briefly mention that we're regularly offering a mindfulness group for autistic children and their caregivers. We're actually starting next week our 8 to 12 age range group, but also hoping to launch an older teenager, autistic teenagers and their family group later this year and maybe next year. So feel free to email us at this email address, csc.asdprograms@nyulangan.org, if you're interested in hearing more about this evidence-based mindfulness group. Now we have 3 minutes for questions. Let me take a look at the chat and see what we have here. Okay. So we have a great question about someone who is saying that they actually become more anxious when they're trying to relax in a mindful activity, or that breathing makes them dizzy. So first of all, for breathing makes them dizzy, I will check that they actually breathe slowly and not fast, because when we breathe, when we take a very fast breath, that's kind of like doing the other direction of, like, instead of taking the high road, it tells us, oh, there's a danger, it kind of like activates our survival mode. So just try to make sure that I breathe in slowly and breathe out slowly. And remember what I said about, sometimes you're going to practice mindfulness and still be anxious. Relaxation is not a guarantee, and we get it, but we do know that becoming more mindful is beneficial for the long term, even if not immediately in the moment. And even, for this child, it's probably very, very helpful to know when they're anxious, so that, for example, they can ask for help, or they can voice their anxiety using words if they're verbal, right? So that was one question. Thank you for that. And another question is about ways to support people who find that calming their brain is difficult. So again, being mindful is not necessarily about calming our brain. It's about keep on practicing and becoming aware of the racing thoughts or anxiety or whatever it is that's our internal experience. And yet, focusing on the anchor, focusing on the breathing, with the idea that after doing it for 5, 10, or 20 minutes a day, I'm going to be better able to switch between the survival brain and the high road, the prefrontal cortex. And then whatever it is that makes me anxious or nervous or uncomfortable, I can actually solve sometimes pretty easily. And if I can't, then maybe I need to accept it a little bit more, and just to leave with, some uncomfortable feelings, because this is unfortunately part of life. So this was 2 questions. Thank you so, so much. We don't have more time, but I really want to thank everyone for participating today. And I would like to, on behalf of the NYU Child Studies Center and the Regional Center for Autism Spectrum Disorder, to thank you all for joining. And you can find a full list of our upcoming webinars, as well as the recordings of previous webinars, at nyulangon.org /CSC webinars. Thanks again, and bye.